Hey YouTube, it's Marquita, and this video is going to be about our birth choices. I'm going to do a separate video in a couple of weeks about our actual birth plan, but I know that I had mentioned a couple weeks back in my video that because of my gestational diabetes, we were going to have to make some alterations to our birth plan or in our birth choices. So I wanted to do a video about an update on those. So for those of you who may not have watched that video, the short version is that my partner and I were planning a home birth from the time we started talking about conceiving. I had a lot of birth trauma in the birth of my daughter, and along with her passing away, a lot of those bad feelings have carried over into this pregnancy. And of course, when you're getting ready to plan a birth, a lot of those feelings come up. And what we wanted to avoid were triggers. So, to avoid a lot of those triggers um, from my past birth trauma, we planned a home birth. In our mind, a home birth was the best way for us to get the outcomes that we wanted. Um, we were able to have a lot more control. We were able to labor as long as we needed to, and some other things that are really important to us. Um, Fast forward to 27, 28 weeks, and I failed my gestational diabetes test, and I was risked out of my home birth from my midwifery practice that I was with. Um, that was a huge, devastating loss to us, and I talked about it a little bit in my video, and I got a couple of comments. They weren't rude comments per se, like they weren't said to be malicious, I don't think. um and they weren't said to be mean, but as a birth advocate and as a doula, and someone who just feels that women should have the right to birth the way that they feel comfortable, I felt like it was appropriate to address it in this video. So the first comment that I got, not only from a couple of YouTube people, but also from some people in my personal life, was that, the thing to focus on, like I felt like the comment was saying to me that I shouldn't be sad because I'm not getting my home birth, because at the end I'll get a happy, healthy baby. And the issue with that, and the issue with saying that to women who are planning a certain birth and they don't get that birth, or before that birth happens they have to change their birth plans. The issue with telling women that is that sometimes you don't always get a happy and healthy baby. I went through labor and delivery with my daughter, and my daughter passed away. Labor doesn't always equal a happy, healthy baby. Um, Anything can happen during labor, anything can happen during delivery. Um, and those are the kind of comments and statements that stay with some women when things go wrong in their pregnancies or in their births. That, everybody said that if I did it this way, then I would have a happy, healthy baby. And that's not necessarily the case. Um, the second comment that I got that kind of really bothered me was that, once you have your baby here, once you have, which is kind of like a continuation of the first comment, once you have your happy, healthy baby here, your birth experience won't matter that much to you. And that really troubles me, because that's the reason why those of us who are like dedicated birth advocates, that's why we do what we do. If so many other people just felt like the birth experience didn't matter, I don't think midwives would do what they do. I don't think doulas would do what they do. I don't think childbirth educators would do what they do if it didn't matter. Um, Not only does a birth experience matter for the mother, um, there have been studies that have shown that women who are Alzheimer's patients, late in life, they might not be able to remember their actual children. They might not be able to remember their names. But one thing studies have shown is that they always remember their birth experience. And that's something that's really powerful to me. That was one of the things that helped me want to become a birth advocate and want to help these women have these experiences. Um, Another thing is that a lot of studies have started to show that birth experiences for babies matter. It used to be back in the 70s, it was believed that babies didn't feel pain and that they weren't conscious when they were like coming through this journey of being born. And those studies have now been refuted. It's shown that babies do. They are aware of being born. I mean, babies do all the work in labor. We, as the birthing mothers, just have to breathe, stay calm, and push. Babies have to, get into position, get head down. They have to rotate at different points in the labor. And so they're aware of these things. So a lot of people have started to say that how a baby is born says a lot. It's the baby's first life experience. So I completely agree that if I were to have a C-section, if it was like an unexpected, non-planned C-section and it was for the betterment of myself or my baby's life, then of course I'm not going to say, oh my God, my experience was ruined. But I'm also not the type of person who takes things at face value. Um, I feel like women who get pregnant and even women who are trying to conceive, we need to empower ourselves. We need to be educated. Um, yes, doctors go to school and midwives go to school for lots of years. They're very educated. I will not refute that at all. But the birth system in general has so much fear based knowledge that we as women really need to start taking back our births and really start to explore our options. So that is my soapbox for that. Um, I know that there's some YouTube subscribers who said those things. Don't take it as me calling you out. I'm not calling you out at all, because if I wanted to be mean and malicious and call you out, like I would go through saying who said it. It's not even that. What I'm saying is that sometimes we need to be careful about what we say to each other as women, and sometimes we need to be careful of and remember people's backgrounds. Um, for people to tell me that, well, at least I'll get a happy and healthy baby, I still have that trigger of, well, I have a baby who passed away. So saying that to me is kind of like a duh. I'm not doing these things so that I don't have a happy and healthy baby. Clearly, I don't want my baby to not live. So that is the preface to all of this. So after I got my gestational diabetes diagnosis and I was risked out of my home birth, I was transferred to a teaching hospital here in Seattle. And at first, I felt really defeated. I was really upset because I knew that gestational diabetes, it does make you high risk, but there are ways to manage it with diet and exercise. And when I went to this health provider at this teaching hospital, the first thing they wanted to do was give me medication. And even though my numbers were very well managed. So after having a couple appointments with them, and I'll talk about that a little bit later in my other video about the scans that we had, and the combination of them trying to shove medication down my throat and have me participate in a study, we fired our doctor. We have been researching and interviewing midwives, both home birth and hospital birth midwives, for the past 2 weeks. And we have finally made a decision that we're going to go with a midwifery group here in town that does births at the most VBAC friendly facility in the state. If you want to have a VBAC, this is the place to do it. Their VBAC rates are as high as about 80% of the women who attempt them. 80% usually get them, which is excellent because a lot of other places are 50% and below. So we're really excited to be going with this new midwifery group. I love them. They're awesome. I'm still sad that I'm not getting my home birth, but my plan is to try to make my birth experience as awesome as it can be in the hospital, which means writing up a birth plan, making my wishes explicitly known, and really communicating with my care provider. The awesome thing is that it's like a birth center basically. It's not like a hospital environment. So it's like, being at a birth center, it's, that's the medium in between hospital and home birth is a birth center. So it's like a birth center, I'm saying like a birth center because it's not per se a birth center. VBACs, which are vaginal birth after cesarean, you can't birth in a birth center. So it's really it's confusing as to explain what it is. But if somebody doesn't get it, send me a question. Send me the question that you have so I can better clarify it. And I definitely will. And when I do my birth plan video, that will probably clear up a lot of the confusion as well. So we're really happy with the decision that we made. We're going to the hospital/birth center. This the midwife has no plans to induce me unless I get past 42 weeks because my gestational diabetes is diet controlled. I did refuse medication for my gestational diabetes because it was unnecessary. And so since I'm diet control, I can go to 42 weeks before we talk about induction or C-section. So I'm really excited about that. We're really happy about that. We're able to sleep a lot better. And like I said, I just encourage all women who are trying to conceive, who are currently pregnant, even if you're at 35 and a half weeks and you don't like your care provider, you don't like what they're telling you, research, figure out what they're saying, and if it means firing your doctor with a suitable backup, needless to say, then if that's a decision that you and your partner or yourself come to, do it. Don't have your birth experience cheapened or ruined because other people feel like you're being ridiculous or other people don't understand, because it's something that lives with you for the rest of your life. So make your birth experience count, no matter what that is. If that means that's for you going to get an epidural or a repeat C-section, if that's what you choose, then that's great. Like I said, I'm a birth advocate. I don't agree with repeat C-sections. I don't agree with epidurals, you know, as soon as you get to the hospital, stuff like that. But other women do, and those are their birth experiences, and who am I to judge them for their birth experiences? So the same thing for me. I don't feel like I should be judged for mine. So if you have any questions about my birth center, if you want more information about my birth center, if you have more questions about birth experiences or anything else, leave them in the comment section below and I will do an update follow-up video when we have our birth plan all finalized. Thanks. Bye.